I talked about intralesional therapies in general. TVEC was one of them. The idea is, how can we integrate and use this new modality, which is unique in that it's really a direct tumor injection for patients who have tumors that you can reach with a needle, and use that way to synergize or enhance the effects of these new exciting other treatments like other immunotherapies. As we all know, there is already the approval in the United States and some other countries in Europe of TVEC for monotherapy, but that's got limited application because the patients would have to have limited disease. The future really is in understanding how we could combine these agents. TVEC is one of them, of course, there are others in development, and see if we can use the fact that they don't have overlapping toxicity, the fact that a local treatment might enhance the immune response to that tumor by attracting antigens to that tumor, and then adding a checkpoint inhibitor to make the whole system work so much better and more powerfully without adding toxicity. That's the beauty of it. The modality is systemic. You combine that with local and then get the benefits of both. And the reason I said we would combine it mostly with immunotherapy agents like checkpoint inhibitors is because these intralesional therapies are oncolytic and they are immune-based in the sense that they have a local and a systemic effect of their own, which is very interesting, and that systemic effect is already an immune-based effect. So if you add immunotherapy, you get a double immune effect. But I don't see a reason why you could not combine them with other types of systemic therapies, like even targeted agents. Absolutely, and that's the whole, the issue right now is some tumors respond well to immunotherapy, we know, some don't. And the theory is that the ones that don't respond just have a tumor that we call as a cold tumor. It doesn't have the infiltration, the microenvironment that is conducive to an immune response. So what can we do to fix that? And an intralesional approach is one of them. The TVEC is being combined right now in a randomized trial with pembrolizumab. I think that's going to be the most important one because it's a randomized double-blinded placebo-controlled trial. But there are several other agents like PV10, HF10 that are also being combined with immunotherapies like anti-CTLA-4, such as ipilimumab, and with pembrolizumab as well. My feeling is that the future of oncolytic therapy is either for limited patients who either don't need or are not candidates for systemic therapy and have localized disease, and that's a very small number. But the future really is combining it. The future is figuring out the right combination, the right sequence, and integrating. I consider oncolytic therapies to be one more tool. And, as we've talked, it's a tool that doesn't overlap in terms of side effects and other issues that come up with systemic treatment. So it's such a nice marriage, if you will, that we can find a way to put these together. So I think the future is going to be in combination and figuring out which patient needs it and in what sequence.